Meanwhile, Delhi Lieutenant Governor has now instructed all hospitals to prominently display availability of beds and charge structure. Also mandates that details of contact person for admission to be displayed. Rajasthan seals its borders after seeing a surge in cases. No entry into the state without an NOC. Rajasthan has recorded over 11,200 COVID cases and 255 deaths. Chennai administration admits that deaths have been underreported. At least 236 COVID deaths in the city went unreported initially. A panel has been formed to probe the discrepancy in the death count. Over 300 doctors treating COVID patients at a Hyderabad hospital sit on an indefinite protest after a doctor is attacked by patient's skin. Doctors say the central government's assurance to protect frontline warriors has failed. Two people dead as fire at Oil India's gas well rages on in Assam's Tinsukia. Officials say it will take 3 to 4 weeks to extinguish the fire. 2 Oil India employees suspended for negligence. Despite revival of train services, passengers wary of travelling to Mumbai. Mirror Now special report from railway station in Mumbai shows how train coaches are returning almost empty to the city. The ICC meet today to determine fate of T20 World Cup in Australia in October this year. Cancellation could open up the window for a curtailed IPL season. Good evening and good to have you with us at this edition of the Urban Debate. Viewers, the next 2 hours is a special non-stop broadcast that we are bringing to you on a special report. It is the Times Network Protiviti India Outbreak report. Now, in the past, we've got to you various projections that have been made on the basis of the statistics that are shared with us by the government. But today, we are not going to project. Today, we are actually going to see how the battle has been fought so far. Today we are going to bring you the trends to tell you whether your state is lagging or leading, to tell you whether your city is lagging or leading. So over the next 2 hours, we are going to first focus on the states and how some of the biggest states of our country are really battling coronavirus, if they are actually losing the battle now or getting a grip and a control on it. Similarly, then at 9 p.m. we're going to talk about the big 4 cities, the big 5 cities that are constantly being tracked by us here on Mirror Now. So let us begin on this special broadcast, the nationwide data that has been put together by the researchers for us, and these are the charts that I'm going to bring to you. Now, before we break it down into different regions, and we'll talk about the southern region, we'll talk about the western region, we'll bring you the details of the recoveries and the active cases. And then we will join the dots, viewers, to help you understand what these charts mean, what's going right or wrong in various parts of our country. There's always a lesson in what these statistics tell us. There's always a lesson in what policies are working and what aren't, basis the number of cases we've got, basis the kind of testing we are doing, basis the number of recoveries we are seeing. And those are the lessons that we are looking for today. But first up, I just want to tell you the key headlines. Now, from what we have interpreted, of course, our experts will add to it. This is what we see basis the data that has been analyzed. Point number 1, and we told you this for the last 3 days, we've been talking about the national capital. Data statistic matching also shows that Delhi is seeing a clear increase in cases and a fall in recovery rate. And this turnaround actually has happened largely in the last 10 days. Maharashtra is beginning to get a grip on the number of cases. Maharashtra has been on the top of the charts, but some of the cities now are doing a better job. Mumbai is still close, but several other cities are doing a better job. Gujarat seems to have hit its peak in May. So there's some good news coming in for people who are living in Gujarat. And there is now an improvement in the recovery rate there. This is what we will show you in our charts in just a bit. Kerala, viewers, is a very interesting story and we'll spend some time on it. Kerala almost almost won the battle. They had almost finished off their cases. There was a time where for a period of 3 to 4 days, they barely had more than 1 or 2 cases being registered daily. But now the cases are on the rise again. So we need to understand what's going on. Telangana is beginning to see more active cases in June despite the very, very strict clampdown. Tamil Nadu saw recovery rates surpass the active rate 2 times. So it's actually gone up and down and up and down. Every time they let their guard down, there is one big event that takes place that leads to a further surge in the number of cases. There's a lesson for that in Tamil Nadu. Uttar Pradesh is seeing a higher recovery rate, but it's a flat trend. There's not much change. It's almost as if it's in a controlled manner. The data is, being put out between recovery and active cases. But it is under control and the recovery rate is good. West Bengal saw a flat recovery rate, but now the active cases are on the rise, and it's going to be very clear from the charts as well that we put out to you. Karnataka saw a recovery rate improve in May, but right now Karnataka needs to be on the watch. That's what the data is suggesting. And these are not projections, viewers. I will again say these are statistics of cases and recoveries so far for a report dated 10th of June. That's as recent as this information is. Haryana is an interesting state. We'll talk about it as well. It's an outlier with a rise and rise and fall again. And the recoveries and the active cases going in opposite directions multiple times. It's very interesting what's happening in Haryana. I'm going to start with southern India. And one by one, let's pull up the charts for you. And let's show you that graphics. Let's start with Kerala, viewers. Kerala is a very interesting, state. The Kerala was actually praised by many for the way they had handled it. Remember, the first cases came in Kerala from Wuhan. There were just a handful of them, and then there was a bit of a lull. And then when COVID actually hit the entire country is when Kerala also see the cases go up. And then it fell again. Now, in the last few weeks, as shops have begun to open, as restaurants and salons have opened, as people have begun to come back, international Indians stranded abroad, Indians stranded in other states, as all of them are traveling back to the state, the numbers are on the rise, and so the Kerala government needs to be on the guard. Tamil Nadu, the recovery rate surpassed the active cases around end of April, but then it went up again in May. And in fact, in Tamil Nadu, it's very closely linked to the amount of testing they do. When they ramp it up, you see that cases go up. When there are events like what happened in Coimbatore market, and before that again, that's when the cases go up, because you see large-scale violation of social distancing, and that's what the chart is also actually showing you right now. Telangana is a little difficult to judge, and so we're going to ask our experts to do that in just a bit, because the recovery rate actually crossed 50% mark towards end of May. But the active cases have now begun to rise. And Telangana so far has been one of the first states to keep extending the lockdown in its current avatar. But they're also very low in testing. And they're also not very transparent when it comes to data. So that will require a separate conversation. And Karnataka, viewers. Karnataka was doing quite well. Its recovery rate improved till the first week of May, but now it's beginning to flatten out and it's just staying like that. So let's get in our experts and let's try and understand what's working for which state. Amar Devalapalli, senior journalist, joins us this evening. Dr. Rajkumar, consultant for pediatric infectious diseases at the Global Health City, Chennai, with us this evening. Dr. Padmanabha Shenoy, rheumatologist and immunologist, joining us from Kochi this evening. But first up, I want to go across to Vinay Tiwari. Vinay, let's begin with, what you make of this data. And we've specifically chosen the southern states because, they seem to be doing great at one point of time. But for many states now, there is a change in that trend.
Right, and before I spell that out, Tanvi, I think it's very important to re-emphasize a few things to our viewers, because data can sometimes be intimidating, and I think sometimes people can get confused between different data points. First up, the big clarity: this is not a projection. These are based on actual numbers, and they are numbers derived from actual government data which is updated as on yesterday. So this is the absolute authentic official data. Remember, corona is a notifiable disease, so any case that happens has to be notified to the authorities. Whether it's actually getting done or recorded is a different discussion, but this is the official data, and these are actual numbers that we are tracking. Also remember, the Times Network has been doing this Protiviti study for the last 2.5 months now. So this is not something that we've done just once. We've been tracking it for the last 2.5 months since the corona crisis really picked up pace in India. And we've been observing trends on how different states are reacting and responding on terms of the on ground, and how that response is actually translating itself to the data, to the numbers of cases that is being reported as well. One important point for everyone to understand who's watching this right now is this. Whenever the number of recoveries are higher than the number of fresh new active cases, is when you can say that the state is doing a good job. Because clearly, if the number of people who are recovering from an ailment after having contracted it is higher than the number of fresh people who are getting that ailment, you seem to have done a good job. And that's why if you see in our graphic, there is an eye formation, where almost like it looks like an eye. The wider that particular eye, the better your state will be. And whenever the x-axis and the y-axis crosses or comes close to each other is where the problem starts. And that's why it's very important to watch those graphics very carefully and to see how the states have performed over the last 2.5 months, and that will give you an indicator of how easy you can breathe going forward. Now, coming to your question, Tanvi, about the southern states, yes, southern states were a lot like the Indian cricket team. They started off very, very well. The top order did exceedingly well. Kerala was a great example of how they spotted the trend early. In fact, as early as even January, for instance, that they realized that there is something. And I remember, and I know that our reporters on the ground have been telling us that even in January, much before even anyone was talking about corona, the health ministry had started doing discussions about what was happening in Wuhan, because they knew there are a lot of Kerala residents who work in that part of the world. But while that was then, in the last 15 days or 20 days or so, some bit of movement of people has started happening. People have started arriving back in the state. And obviously, that could be one reason why you are now seeing a bit of a rise in the number of cases. Tamil Nadu was always, Tanvi, a bit of a problem state. I mean, if you remember, right from the time when the lockdown was first announced, our ground reports were constantly pointing out how the implementation of the policy on ground in Tamil Nadu was not always very effective. And there was also a lack of uniformity. And that again gets, reflected in the data. Karnataka, amongst the 5 southern states, seems to be doing the better of them all. Bangalore, certainly as a city, has done probably the best amongst all metros. And that actually is a good sign and a very good news. You were right about Telangana. There is a problem in the way the reportage is happening. There is not much transparency. The government has been very opaque about sharing information, specifically testing data and so on and so forth. So that's a little bit of a tough nut to crack. But yes, the larger picture, if I can set it up at the start, is this: that the south of India, which had started off exceedingly well, is now beginning to show some problems in terms of the rise, and that's where we have to watch out for. As opposed to, say, the west of India, which had started off very badly and has now started stabilizing, so has central and probably north as well, except possibly Haryana, which is a bit of a basket case, as well as Delhi, where the pattern has been very opposite. Tanvi.
Okay, so let's take it one by one, and I ask our experts. Dr. Shenoy, let's begin with you, because Kerala honestly did do a great job of containing it, of contact tracing it. I think they really set the example for the entire country to figure out how contact tracing will have to be done in the initial days. But obviously, if you look at the recovery rate and the active cases rate and the way it's moved now, there is a bit of a concern. Now, to what will you attribute that?
It is very clear. See, Kerala had a huge return of non-residential Keralites coming to Kerala. Almost 2 lakh people have come. So we expect that there is going to be a rise. It was expected by Kerala government. Like from Wuhan, people came and we had an increase in case. We had the first case in the country. For first 3 cases were reported in Kerala. We contained it. What is Kerala doing is very clear. Isolate the people who are coming from outside and make them sit at home so that there is no contact spread. There is no spread of disease from them to others. So if you look at the 2,000 odd cases, less than 10% has been spread by contact. It's a remarkable record. But the most important thing is still the journey is on. Although number of cases are rising, all of them are diagnosed inside hospital, inside their quarantine centers, be it at their home, be it a COVID care center. So it is very clear that Kerala is still doing reasonably good job. So increasing cases is not worrying me. What is worrying me is there are positivity of Kerala, number of test positivity, that is test divided by case used to be extremely good, 70, 80, 100 for Kerala. But for last 2 weeks, it has come down to 50. So we should remember that Delhi and Gujarat are having 1 in 6 or 1 in 7. Out of that, Kerala is having 1 in 50. So still it's reasonably good, but positivity is decreasing. And third worrying thing, what I think is there are 3 or 4 deaths which have happened over last 1 week, where source of from where they got is not clear. That is the most worrying thing for Kerala. I don't think the rise in case is expected. 100 cases, 80 cases out of 5,000, 6,000 people who are returning from abroad is expected. There is nothing to worry in that, and they are not diagnosed in the COVID care facility. So what is worrying is the deaths where cause is from where they got the disease is not clear. 3 or 4 deaths have happened out of 16 deaths. 4 of them from where they got disease, we are not sure. Source of disease is not clear. That is what is worrying for us, rather than having a huge spike in cases.
Okay, fair enough. In fact, largely what you're saying, it is also because of the people who are now coming into the state and additional cases that have emerged, which is, it does coincide with the way the chart shows the graph turning for Kerala. The time where they had hit, where, there were a couple of days when no cases were reported, and then 1 case or 2 cases were getting reported, to now what we are seeing on a daily basis, there are quite a few cases getting reported. Similarly now, Tamil Nadu has an interesting trend. In Tamil Nadu, viewers, if you see, and we'll bring up the chart for you, every time they manage to get things under control and the recovery rate actually goes up, and the recovery rate actually becomes better than the number of active cases being registered, or the active rate itself. You see, it's around the time that the next lockdown version gets announced. And the minute that happens and the city or the state opens up a little bit more, you see a bump up in cases in a few days after that. It's happened twice. It happened around the first week of May. It's now happened around between 20th and 27th of May. And now in the last few days, that's where you're seeing the gap between the active rate and the recovery rate narrowing again. So if we had to go by this trend, Dr. Rajkumar, would you say that it's largely because every time we open up a little more, there is a spike initially, but then the state kind of gets a grip on it?
First, we need to accept that disease is inevitable. It's going to happen. We are not immune to it. So at least 60 to 70% of the population get the disease. We are going to have it going around. And Tamil Nadu had a good model. It has been always a good model. I appreciate the government for whatever its efforts are. Initially, we were in the preventive phase. Then we went into the control phase. Now we are in the containment phase. So what government is doing from that side is definitely fair. So now they are targeting towards finding out symptomatic patients and handling them. And from public aspects, yeah, definitely there are some weakness on the public aspects. The people cooperation is definitely less. So that is adding upon to the cases. But what we need to realize is that this our city is like a metro city, and this is the same. Wherever you see the way in the Western world and also in other major cities in India, this is the trend. So being a metro city, definitely the numbers are going to be high. It's not about the race, but what we are concerned is to reduce the mortality. The overall target for us is to reduce the mortality and get the people out as much as possible. And definitely we are working towards it.
Okay, but is there something that you believe that Tamil Nadu needs to watch out for? Because Tamil Nadu is one of the states that has seen multiple curves and ups and downs. Clearly, it looks like the minute you let your guard down, there is a spike in cases.
In Tamil Nadu, we are changing the strategy. Government is ready to accept that the rise in cases, and they are trying to get the strategy better so that we manage things better. So from the government aspect, what they are doing is they are increasing the number of beds. So both in the private center and government setups, they are increasing the beds, and they are categorizing the patients like mild, moderate, and severe. And they have created COVID centers, COVID health centers, and COVID hospitals so that all patients are taken care. So government aspects, they are fine, and they are targeting towards identifying symptomatic patients so that we can save them. So that is a target. And in fact, now they have started bringing doctors from other districts to help in these settings so that the case management will also be better. So from the government aspects, definitely they are better. Coming to the public aspects, yeah, people have started relaxing. That is something a bad news. Okay, so people should be aware. People should not take it lightly and should cooperate to the government that way. And again, if symptoms develop, they should come to the hospital. That's one thing I really worry about. People don't come to the hospital immediately, and that again leads to the death aspect. So it's a public cooperation that is more important at this moment.
Okay. Vinay, you wanted to come in and make a point?
No, look, I'll be a little more direct than what our learned doctor has said. And I'll be honest with you, Tamil Nadu, it's very clear. And the best way to actually do a comparative analysis is to see what Bengaluru did, what other metros and others. See, the difficulty factor or every other factor that the doctor has mentioned is the same in most metros. Topographically, most metros are similar in nature. But there is one big difference. Bengaluru's success has come or the up and down graph that you see and the fact that the point that you mentioned about they tend to relax. What does this mean? This is poor implementation of the containment policy. That is part one. You really need, while you will open up, you will have to open up the cities and you will have to open up your states because economic activity has to revive. It is equally important to ensure that the containment policy and strategy needs to be strict and smart. And I think our reportage on the ground and all our reporters who've been around in Chennai and in other parts of Tamil Nadu have shown that the containment policy and strategy has not been effective. People have also not contributed to it because they don't seem to be following the rules. I mean, we've reported day after day to suggest that in Chennai and around Chennai, people are just not following the rules that have been laid in place by the municipal corporation or by the police. So clearly, it's a failure of a bit of a strict implementation of the containment policy and a complete disregard for what should have been a much stronger enforcement of the social distancing norm as well as people and the regular activity resuming. I mean, they took it a little lightly way too early and have now paid a price for that, Tanvi.
Okay, let me also bring in Mr. Devalapalli. Mr. Devalapalli, let's begin with what we're seeing in Telangana. And Telangana is a bit of a mystery because honestly, we don't get the data that easily. Sometimes there's a problem, in the government sharing that data. The testing is far too low, so it's difficult to even make out of what we are getting. But what is your own sense of how, this state has been handling the coronavirus?
Good evening. I'm sorry I was asked to participate in this discussion to speak on Andhra Pradesh situation. See, I cannot often tell you about Telangana. See, I can speak to you about Andhra Pradesh. In fact,
let's
your
also
people
speak
asked me
about
to speak
Andhra
on Andhra
Pradesh.
Pradesh.
Yes, because while it is right next to Telangana, it does have a slightly different trend. And in fact, in Andhra Pradesh, we did see the recovery rate go above and cross the active cases rate in the month of May. But right now, we're seeing the gap narrow down significantly, Mr. Devalapalli.
No, Miss, the statistics I have is, see, Andhra Pradesh, since the beginning of the outbreak of the pandemic, has been very much in the forefront to combat it. In fact, some states were shying away for aggressive testing. The aggressive testing, I am telling you, the latest report of today's is the 15,000 samples were tested and only 136 positive cases were there. In total, the positive cases in Andhra Pradesh are only 4,126 and total deaths are only 78. The Andhra Pradesh government, the Chief Minister of Andhra Pradesh, Mr. Jagannath Reddy's total concentration is on to see that the deaths are less and the testing is done and every household survey was done multiple times. The greatest advantage Andhra Pradesh state has is immediately after this government took over 1 year back, has appointed the village volunteers. Every 50 households in a village, one volunteer will be there. He will go and survey and see who is there, what is happening as somebody came from outside. So this kind of a survey was done in 1 crore houses in Andhra Pradesh. That really gave a good result, and now the increased testing of the thing has come to has given a very positive result. So that is where the Andhra Pradesh was the first to procure rapid testing kits also, following ICMR guidelines religiously while tracing and testing, treating the symptomatic and asymptomatic cases had been taken up. So that is why Andhra Pradesh still is in the control today.
Okay, that's as far as Andhra Pradesh is concerned. But Vinay, if I can just bring you in again on Telangana, because that is one state, despite the a city as big as Hyderabad there, which has become a problem point. their testing has been abysmally low. Now they have ramped it up to some extent in the last couple of weeks, but it is difficult to judge the data just on the basis of the numbers we are seeing.
Absolutely, and Mr. Develapalli will bear me out on this. I mean, Andhra has been, a stark contrast to how Telangana has responded. I mean, they were very opaque at the start. In fact, sometimes they were actually hostile in terms of sharing information. We've been hearing all kinds of stories of difficulties that people are facing in the hospitals. There has been resistance. They were testing very, very low. In fact, now they've started testing a little bit more, and you can see there's a clear rise in the number of active cases that they've reported. So it's very starkly contrasting picture with two neighboring states. And it is, I think what all chief ministers and all governments must understand, that viruses don't respect geographical boundaries. And this whole data game that they are trying to play, or any state is trying to play, is counterproductive. This is not how you will ever be able to fight this battle. The virus is not going away anywhere. States and the governments have to learn how to deal with it. And the only way you can deal with it is by admitting and accepting the data and figuring out a strategy basis that. Data in this case is an ally. It is not your enemy. And I think there are some states which are mistakenly thinking that data is an enemy, and hence they're trying to hide this or test low so that they just look better. This virus isn't going away. This is an affliction. It can happen to anybody, and it will not respect geographical boundaries. So by not doing what the state government should do, it will have impact even on neighboring states like Andhra, for instance, because at some stage there will be some interstate movement of people that will happen. And that is why this whole concept of states trying to look at data and then figure out that strategy by keeping it compressed is not a good one. And Telangana is an example of that, Tanvi.
Yes, and in fact, this question has been raised for many states, because the minute you reduce your testing as a proportion, your number of cases go down. It looks good on the face of it, but it does become a problem, some or the other time, any which ways. And that's something that the states should keep in mind. Now, I just want to, go back to Dr. Shenoy on this one question. Dr. Shenoy, let's also explain to our viewers what are the key factors which are involved. Which is what will help us understand where some states do better than the other. One, of course, is your policy and strictness of implementation of your lockdown. Second is testing. Are there other factors involved, geographically speaking, the way a state's population or demography or geography is defined? Does that also, reflect in our active cases and recoveries?
Yes, yes. The most important thing, I think, what Kerala has done is Kerala has a very good public health system. And like doctors previously told, there are ASHA workers which are, they know each household. So what has been starting in the Kerala's control of disease is tracing and isolating. For example, when Kerala had each case is diagnosed, there are 70 in community, 70 to 80 primary contacts are isolated. So once Kerala has around 200 cases, they will isolate 20,000 people in their households, and they will be tested. This is when compared with Gujarat, when Ahmedabad has 3,000 to 4,000 cases, they will isolate only 20,000 people. So number of quarantine for a single case and tracing is extremely good. So it will ensure that the community spread has not happened. And we can very clearly see out of these 2,000 cases, less than 100 cases or even 60, 70 cases were diagnosed from community. Most were diagnosed in quarantine centers. So the isolation of their primary contact is also pretty easy. So the key takeaway is you have to trace and isolate. It's not rocket science. Let me be very clear. It's not a rocket science. You have to trace, test, and isolate who are likely to get the disease. And that is the way Kerala has followed till now. But in the first phase, it was excellent because we had the protection of lockdown. In the second phase, the lockdown is not there. So there are some people who are jumping the quarantine, but they are being again traced with geofencing, etc., etc. But the amount of cases being registered for quarantine jumping is increasing because the amount of people who have come from abroad are very high. 2 lakh people have already come to Kerala from other states and other part of the world. Because as you know, Keralites are known for their being in different parts of the world. So a lot of people have come back, and quarantine thing is a big challenge. So Kerala is going to have a tough road ahead. But till now, Kerala has done reasonably well in isolating, quarantining those people. So there is no virus in the community. That is one of the very good advantages Kerala has. If you look at the community of Kerala, in the society of Kerala, there is no virus, and people are not presenting with a severe acute respiratory illness and being diagnosed as COVID. That has not happened in Kerala. So
Yes, okay, all right. There are
That's another part of
different
it.
factors, correct? You're right there. I just want to pull up, if I can just come in, and I just want to pull up the chart for Karnataka as well. And I just want to show to our viewers in Karnataka what's happening is that they started off with a high number of active cases, relatively speaking, as far as in comparison to recovery. Around the first week of May, there was a bit of, there were a few days where you actually saw the recovery rate above the active rate, but that lasted barely a handful of days, and then again the situation turned around. Now, bucking the trend of all the other southern states where you're actually seeing the gap widening, here it's narrowing in the terms of recovery rate improving and the active rate case coming down. So Karnataka clearly, even as the lockdown, relaxed and people movement begins, more people fly in from outside of the country, from other parts of the country back to Karnataka. Because they also have a very clear, strict policy about institutional quarantine and home quarantine, and if you don't take up the institutional quarantine as per rule, they will even send you back. They've done that. And you can see that the impact of that is that the recovery rate is now beginning to improve and active rate is coming down. This is something that Vinay was also speaking about. The Karnataka model also reflects in the Bengaluru city model as well, and we will come to that when we reach the cities. But this is not what is happening, Dr. Rajkumar, as far as Tamil Nadu is concerned. Tamil Nadu goes up and down, up and down. Kerala is having a problem which we are seeing, which is because of people coming in from outside. Telangana is also a problem. How is it that the Karnataka seems to be bucking the trend?
We need to realize that as a country as a whole, each state behaves differently. We could see that Bombay is going up now, and Tamil Nadu started going up just from now. So it's like that. So each state behaves differently, and each state has its own different trend. So someday I also expect Karnataka to go through this phase. We already crossed this phase, and Karnataka I expect us to go through this phase. So what as a government, what our government is doing is definitely they are doing a good job. I will definitely appreciate them. They are taking things on a day-to-day basis. We need to accept that. They have details of each street which has maximum cases. So they're trying to create micro zones so that they can contain them. There is one aspect. And they're also trying to help with the critical care system. They're providing with as much ventilators so that the sick are not compromised. And again, even the mild cases who develop symptoms, who collapse within 2 to 3 days, they're trying to find solutions to help them also. The one main thing is people, if they develop symptoms, should come to the hospital, irrespective of what they are, irrespective of the age, irrespective of the comorbidities, like that. They're going to come to the hospital, they get tested. Definitely, people are there to take care. Definitely, people are there to support, and that way, definitely, we can fight with mortality in this disease.
Okay, let me go back to Mr. Amar also as well on this. Mr. Amar, again the same concern that we are seeing for some of the other states, even in Andhra Pradesh, the recovery rate, is going down while the active cases rate is going up. In the last few days, we've seen this trend. What is the government's view on that?
Yeah, as of June 10th, that is today, there are 4,98,716 tests were done. See, this is the maximum being done in the country. I think Andhra Pradesh stands first in the conducting the test. They tracing the cases and tracing them, isolating them, and treating them. In fact, after treating also for the poor people, the government is giving some financial help. I don't think it is the total deaths are 78 in the whole 3.5 months of this corona thing. The total deaths are only 78 and total positive cases are 4,126. When there were about 4,98,000, almost 5 lakh tests were conducted. This was possible because of the household survey and the transparency maintained by the state government. I totally accept with Mr. Vinay what he said about Andhra Pradesh in comparison with Telangana and Andhra Pradesh. Definitely Andhra Pradesh is more transparent. Andhra Pradesh government is more transparent, giving every day-to-day bulletins about the situation.
Well, Andhra
Yeah.
Pradesh, you are right on the fact that there has been very aggressive on its testing. Was one of the first states to actually, look outside at other countries and import the testing kits and whatever was required. But the fact of the matter is, viewers, for most of the states in South India right now, as the lockdown gets lifted, there are changes in the trend, and that's something that all the states have to keep in mind, and the authorities need to be alert for. Thank you so much to the panelists who've joined us in the first round of this conversation, which was about the states of Karnataka, Andhra, Kerala, Tamil Nadu, as well as Telangana. Now, let's move a little towards Western India, and let's talk about two of the key states which have few key problem cities with high number of cases. But these two states are actually relatively better off today than they were earlier. So unlike the southern India, where the problem seems to have become a little more grave now, and they seem to be doing much better in around mid-May, in Maharashtra and Gujarat, that's not the picture. So let's talk about Maharashtra and let's talk about Gujarat and get you those details. And I actually first up want to pull up Gujarat for you. Gujarat actually saw, viewers, a turnaround between 25th of May and 30th of May. Now, this is much after the 17th May lockdown 4th version that had kicked in, which had significant amount of relaxations coming in. That also did not have an impact on their cases, number of cases, and the active cases rate actually went down and the recovered percentage went up. And since then, since about 3rd of June, since the time that we've actually come into Unlock India phase, they seem to be holding on to those levels. The recovery rate seems to be stable. The active case rate also seems to be stable. So it's a very, very interesting trend that we are picking up as far as Gujarat is concerned. The trend is upward for recovery to confirmed ratio. That's what it indicates. And if this continues, we will have to see whether the active case rates then begins to fall. This is as far as Gujarat is concerned. That's a state where the authorities very clearly started demarking people who are high-risk contacts, shopkeepers, vendors, delivery guys, newspaper guys, and started testing them. So that was a very specific policy that Gujarat implemented, especially in Ahmedabad. And they went and they found out who were the infected people in these zones. The minute you clamp down and isolate those people, your rate of infection immediately comes down. That's one thing that has worked for Gujarat. We will have our experts telling you a bit more in just a bit. Let's also get you the details from Maharashtra. Maharashtra, since the beginning, has been a bit of a challenge. Maharashtra was a state that was literally on top of the charts, but now, despite how the southern states are doing in West India, Maharashtra seems to be seeing some amount of relief coming in. I don't even have to say to you, you look at that chart and you will see that there is a very distinct difference on what's happening post 27th of May, where the active case rate came down a little and then has stabilized at that level. Similarly, the recovery rate went up, improved, and then has stabilized. Now, keep in mind, viewers, that these charts that we are showing to you and this analysis that is being done is on the basis of the data that the government gives us. It's on the basis of the number of active cases, total number of cases, total number of recoveries, how many people are getting discharged, what the government shares with us. So this is what the data shows. Let's also say good evening to the panelists who are joining us. I have Ajay Umat, Senior Editor for Nav Gujarat Samay with us this evening, and Dr. Subhash Salunke, a Senior Advisor to the Public Health Foundation of India for Delhi and a member of the COVID Task Force with us this evening. Let me go across to Vinay Tiwari first, and Vinay, let's speak about Maharashtra first, the state that we've closely tracked, and the numbers and the charts do look a little interesting.
They do. And look, I mean, this is a state where we both live. So obviously, we looked at it far more closely than possibly other states as well, got affected by that as well. But Maharashtra was our Indian team of the 90s. They started off very poorly, very, very poorly. In fact, I think Bombay was looking like a case situation where things had gone almost out of control. And to add to the misery of Maharashtra government, Pune was equally bad. And I think in the next hour, Tanvi, when we go to the cities, we'll see that Maharashtra's graph has improved significantly, principally also because Pune has now come under control. It was a situation as bad as possibly Bombay was 3 weeks ago. That seems to have recovered a little bit. But outside of the two big cities that we have, the state has been able to manage it fairly well. And that, I think, is the best thing. I mean, the graph very clearly shows you how both the lines are almost now converging. And when that x-axis gets formed and the number of recovery cases, significantly overtake those who are active cases, Maharashtra can slightly breathe easy. But I think it will serve Maharashtra very well to look at the examples of the states in the south, because the minute you start breathing easy and you think the virus has gone away, it can come back. And I think that's the biggest lesson that other states can draw from each other, that this is not something that's just going to go away. It's not like a game where you hit the final delivery and then the match is over. It's not over. It's only that right now you've been able to manage it. You got to build on it. Keep doing the containment and isolation strategies strictly and follow social distancing strictly, because it can easily come back and a second wave can easily come back, as you're seeing possibly in Kerala, Tanvi.
Yes, absolutely. In fact, let me just look at the last few days data as well. June 5th, Maharashtra had about 77,793 cases. In June 6th, it was about 80,029 cases. June 7th, roughly around 83,000, 82,968 cases. June 8th, 85,975. And June 9th, 88,000. So even here, if you see, it's gradually being the active cases are going up, and it's much better in terms of what we saw in the month of May and the kind of cases that we're seeing in the month of May. But keep in mind, viewers, this can also be a little different from many of the other places, because in Maharashtra, in the key cities of Mumbai and Pune, the relaxations are not as much as they are for some of the other cities and states. So that's something that we have to look at. But let me quickly also bring in Mr. Ajay Umat, senior editor of Nav Gujarat Samay, and understand, what Gujarat is doing that seems to be working for them. Mr. Umat, give us some insights. How has Gujarat fought this battle?
Look, if you see the scenario in Gujarat, after Maharashtra and Tamil Nadu, Gujarat is at number 3 position. The problem in Gujarat is that, compared to Indian average, the mortality rate is highest in Gujarat. It is almost 6.78. Compared to Maharashtra, it is hardly 3%, and in Tamil Nadu, it is less than 1%. So major problem in Gujarat is that, number of people dying at civil hospital in Ahmedabad is highest. If you see I was reading a very interesting paper written by Professor Mavlankar, who is an expert in preventive social medicine. He says that, out of 730 districts, there are 20 districts which has 70% cases of corona in India. And if you study Gujarat, 80% cases are from Baroda, Surat and Ahmedabad city only. And out of these 80% cases which is in Gujarat, 70% mortality took place in Ahmedabad city only. So major problem that government of Gujarat is facing today, though our recovery rate has improved. Our recovery rate has improved significantly, but mortality rate has also, has gone high, and that is a matter of worry. And that was the reason that, Mr. Amit Shah, Home Minister, has sent a team of AIMS, Professor Guleria and others had come here, but they could not find out what is wrong with the medical protocol, why mortality rate is going very, very high. On the other side, Gujarat has, Ahmedabad city has entered into a herd immunity level. Cases are going down in the eastern side, that is, walled city in Ahmedabad, but it is increasing after lockdown on the western side of Ahmedabad. So it shows that, number of cases are going down and down in eastern part of Ahmedabad, but on this side of the cities, that new city, it is going significantly high, and that is also a matter of worry for Ahmedabad city, because medical infrastructure, number of ventilators are now not available, oxygen bed is also in scarcity, and private hospitals, they also are not in a position to provide beds. And another thing, despite High Court order, government is not encouraging private testing, which is a matter of worry in Ahmedabad and in Gujarat also.
Okay, so private testing is still a matter of concern, but in Gujarat, what we have seen is that the numbers spiked after about 700 people, were found positive, who were people who were high risk contacts, and those people who are coming in touch with large number of others, fruit sellers and
Super
vegetable
spreader.
vendors
Super
and
spreader.
shopkeepers or delivery guys. Yes, I mean, I don't like to use that term. I know the government uses it, but I hope it doesn't attach a stigma to any of these people because they are being called super spreaders. But do you think, Mr. Umar, that strategy did work? Because that's not something that many states have done.
No, that strategy has worked. Government of Gujarat has done a wonderful job by, imposing a very strong lockdown in Ahmedabad city. And for 7 consecutive days, they have continued to do screening of vendors, particularly these hawkers, vegetable vendors, flower walas, fruit walas, and others. And they did screening of almost 35,000 such vendors, and then they issued them certificates. And those who had symptomatic conditions, they were taken to COVID care centers, and those who were found positive, almost 700 of them, were treated at civil hospital and SCP hospital in Ahmedabad. So that was a wonderful job done by government of Gujarat and Ahmedabad Municipal Corporation jointly. And that was one of the reasons that now we have recovery rate has improved significantly. But my only worry is that at the same time, mortality rate compared to Maharashtra and Tamil Nadu, it is very high in Ahmedabad, and they need to do some corrective measures there also.
Okay. All right, so that's what the government needs to do as far as Gujarat and specifically the city of Ahmedabad is concerned. There is also another problem, but I'll come to you in just a bit, Mr. Raja Umar, on the healthcare infrastructure part. Let's also come back to the conversation about Maharashtra. And Dr. Salunke is with me. Dr. Salunke, as far as Maharashtra is concerned, it's been a tough battle from day one. Mumbai itself adds to the biggest of the problems for Maharashtra in terms of large number of cases, but we are seeing some amount of slowing down. Would you agree, and why is that happening finally?
I fully agree with you. As a matter of fact, Maharashtra is a peculiar and special situation because of the fact that practically due to initiation of the outbreak or pandemic, the dose of the virus, the fact remains that the people in such a large number first were they created a kind of a situation in Mumbai, and so Mumbai cannot be compared with any other city in India. But you are absolutely right. The concerted efforts on the part of government of Maharashtra, Mumbai Municipal Corporation, and other corporations like Pune, they are now yielding results. And what you are seeing, the definite bridging of the gap between the active cases and recovery. But let me tell you very frankly, as an epidemiologist, and Mr. Tiwari also, your editor also commented on that. I mean, let's not give a lot of importance to this, recovery rate and this rate and that rate. The most important part is going to be how many of these cases are being saved by us, and point that is being repeatedly made as far as Gujarat is concerned is the one I would like to give a lot of importance. Are we in position to design and define our health system in such a way that we are going to save maximum number of lives? Cases are going to increase. Lot of cases who are going to be pre-symptomatic or symptomatic milder cases, recovery rate is going to improve, but it's not a guaranteed. Like we have seen in southern India, recovery rate can cross the active cases and come down again. So do not give lot of importance to the number of cases. Let us now give importance to what facilities we are making to ensure that the lives are saved. Let me assure you and let me assure viewers through you, we are going to get fluctuations in many states. We can't name every state, but fluctuations will occur. We will see declining rates of the newer cases in southern India, including Maharashtra, but you will see increase in cases in eastern and northern India. Are we as a nation prepared for that? That is the major question. Number two, are we going to ensure that we are going to fight this battle for next few months? It's not going to be June, July or August. It could be even up to December, Jan, who knows, even next year. How are we going to ensure that comorbid patients, high-risk patients or high-risk people are saved? And that is where Government of Maharashtra and these two municipal corporations have taken a very proactive step, and I have to appreciate the entire teamwork of these two municipal corporations, which I have myself seen it. The way containment measures, in spite of so many challenges, Dharavi management is a special case in itself. So we have been able to, Municipal Corporation of Mumbai has been able to manage it now. Last 3-4 days, no deaths. So these are few indicators which are showing that we are on a right path, and we need to continue with precaution. With caution.
In fact, Dr. Salunke, I wanted to ask you on Dharavi specifically. How we handle Dharavi, Dr. Salunke, can become a case study for many other places, because it's the
Dharavi is a
most
case
densely
study.
populated slum area, such large population. But look at the numbers we are reporting now. At one point, we were reporting 50, 70, 80 cases every day, a dozen deaths every day. And now we're dozen cases every day.
That's right. It was more than 100. It was more than 100, Please let us compliment and congratulate our Municipal Corporation Mumbai's team. They have done a good job. Their ward level officers, their doctors, the nurses, the ashas, the volunteers, and most important, Dharavi people. Let's not forget. See, let us not take credit by the health system or municipal administration per se in totality. Let us give credit to our teamwork, including society. Unless they themselves want to save them, how can you think about any public health emergency without participation of the community and people to succeed? It's not possible. So if Dharavi has succeeded, credit goes to obviously dedicated staff of Mumbai Municipal Corporation, dedicated people of Dharavi themselves, and ready to listen to the challenges of this epidemic. So it's a combination, and I feel we need to learn from Dharavi even in other areas. On same lines, look at the Pune Municipal Corporation. Look at the areas of the Bhawanipet, look at the areas in Pune which were so challenging just 3-4 weeks back. We ourselves were worried, but I feel we have to appreciate the concerted effort on the part of the team. Like say, Government of Maharashtra identified 4-5 senior level officers. Now they are focusing on specific activities. They are monitoring it not daily but hourly basis. We monitor even with the hospitals, in Sassoon hospitals, in other hospitals, in KEM. I know there are a lot of criticism of the kind of an non-availability of the bed, non-availability of the ambulances in time. But please note, we are dealing with the population of size of Mumbai, and total MMR is 2 crore plus population. So I think let us appreciate that comparatively in a short span of time, the systems are now in place, people are cooperating in spite of relaxation, and this is very encouraging. I'm so happy that in spite of the relaxation or unlocking of this entire system, now it is already 8 days. I'll be more keenly worried for another 8 days, and after 14-15 days, if there is not going to be spurt in the cases, I know we are in a right direction. And Government of Maharashtra, right at the top level, whether Chief Minister, Health Minister, here our Deputy Chief Minister is taking review every week. I'm attending some of these reviews, and I'm fairly impressed with the political commitment, the bureaucratic commitment, and the teamwork, and most importantly, participation of the people themselves.
Well, Well, we are still seeing a stricter level of lockdown that continues in Mumbai and Pune. We still have to come to a point like other cities where we start opening up more. And Dr. Salunke, I have a feeling that the challenge will become tougher then, especially if we don't get our health infrastructure in place. We still don't have enough ICU beds. Most of them are occupied or even otherwise. Hospitals are being made. Vinay, you wanted to make a point before we wrap up this conversation?
No, look, Dr. Salunke and I represent different professions, and we usually tend to see the glass half empty and not exactly the glass half full. I'm not saying that the glass may not be half full, it may be, but let's be honest, the BMC and the Maharashtra government started very badly. The BMC was in a mess, and because they were in a mess, the whole leadership got replaced midway into this war. The good news is that the new leadership that has come in and the Maharashtra government has reacted to criticism probably a little more positively, and I think that's a good sign. They got really criticized for the way they were handling it possibly in May, and the good sign is that they seem to have learned those lessons and are now moving towards fixing it. So that way is good. But to suggest that they were all doing very well from the start was not the case at all. I mean, both Mumbai and Pune were in a very bad shape, and I mean, we know, and our reporters who were out in the field know, that in many cases the bureaucracy was not even talking to each other, even though they were sitting in probably a 2 square kilometer area. I mean, places like Thane, Virar or Vasai, we had problems. So good that they've recovered, and I'm happy that they're now fixing and trying to contain this problem in a better way than they did at the start.
All right, completely out of time. Thank you so much for our panelists for joining us with their insights as far as Gujarat and Maharashtra are concerned, viewers. And this is what it looks like. The southern states that were doing much, much better. And at one point in May, it looked like they may, finally be emerging out of it, hitting their peak and then crossing to the other side where it's only recoveries and improvement. But perhaps because of the fact that we let our guard down, people started to come out, people forgot about social distancing, perhaps also because of the fact that the government's policies were not strict enough or that they were not testing enough and isolating enough. There is a bit of a challenge that continues. Also the fact that there was a lot of travel involved. Lots of people were brought in from abroad. People were allowed to travel within the country, and so the numbers have changed now. But as far as Western India is concerned, both Gujarat and Maharashtra seem to be finally getting a grip on the problem in these states in terms of large number of cases. Both of these states have been in the top 3 at one point in our country, and now they're beginning to at least get a grip on the number of cases, and the recoveries are going up. Too soon to say. We will keep a close track and keep getting you these analysis. Don't go anywhere. We have just done the states so far. The cities are lined up on the other side. Which city do you live? How is that faring? I'll tell you all of those details. Stay with me. Viewers, I promised you that we'll give you the breakup of how the cities are faring, but before that I want to specifically talk about one city and an interesting story, a massive development rather that happened there. Miranao actually found out, as it was tracking data and digging deeper for data, that in Chennai 236 deaths had not been reported, that there was a discrepancy in the data that had actually been put out. So while the authorities were telling us in their daily bulletin that 177 people had died, there were actually 398 who had died. And when Miranao started to get reactions from the government and asked them this question, that's when the government and the authorities actually realized that there was a problem. Pramod, in fact, was doing that story for us, and he's joining us right now. Pramod, it's only after you raised it and asked these questions was there a correction. But how did this happen? What was the explanation given by the government for this data discrepancy?
Well, each and every step we have taken in this investigation, we had to be extremely careful because we are talking about a certain issue which can lead to a widespread panic. And that's the reason, even though we got the data in our hand, we had to go ahead directly to the authorities to find out if it was like accurate or not. For instance, like whenever we asked them about the number, like the excess number of infection and what kind of actions they have taken to contain it, and all about the containment plans and such things like that, the only answer that was provided to us is that you need to only worry about the recovery rate and the mortality rate. And the mortality rate earlier that was given to us was 0.72%, which kind of contradicted the like a nation-wide level mortality rate. So as we started to find out what exactly was happening, we were able to get data, especially about mortuary cards, the death memorandums from various hospitals. We concentrated on two hospitals, one being Stanley Government Hospital and the other one Rajardi Government Hospital. Both are very important hospitals handling a lot of COVID-19 patients. And apparently there were discrepancies. For instance, certain mortuary cards, it was written COVID positive and then it was scratched off. And then when we went online to find out whether any death certificates were available, we couldn't find any. So all these three questions we put forward with the health minister. We did get an abstract of one copy from the Greater Chennai Corporation, which mentioned by June 4th itself, the number of dead in Chennai was 398. It was an abstract copy, and but at that point, the number of dead that was informed in the medical bulletin was not even 200. So we directly questioned him. First, he denied. He said there is no need for anyone to manipulate it. But now it looks like they have went ahead, they have audited, and they have found out that more than 200 deaths were not reported, and now they claim that they will investigate to find out what exactly has happened.
Okay, so let's keep a close track on it, Pramod, and see what they find out in their investigation. Thanks so much for bringing us this story. Imagine the possibility that the authorities underreport the deaths in a city by such a large number. For now, the government has admitted it. We'll watch out what happens next. Time for a quick break. Lots more on the other side. We tell you which cities are leading, which are lagging, what's working right for cities like Jaipur, but what's going horribly wrong for cities like Delhi. Stay with me. Good to have you with us on the 9 p.m. edition of the Urban Debate. Viewers, we've been constantly tracking the data that's released by various state governments and the central government as far as coronavirus is concerned. And then we've constantly been bringing you that analysis. Sometimes we also bring you the projections basis various factors. Today we have an interesting analysis lined up for you. And we are going to be looking at the recovery rate and the active cases rate, and how that curve really moves for various cities, how it has moved in the past 2 months, right up to the point of last week. The idea, viewers, is to see which city is getting what policy right, what could have been the possible reasons when there have been a spike in cases, what policies have worked in controlling the cases. The idea is to watch out for the lessons that these charts and graphs and numbers are telling us. Only that can help us as we move forward, because coronavirus, like I keep saying, isn't going away. We have to learn to live with it. And as we open up, the cases are bound to go up, but by now we should have at least some idea about how to bring it under control. So the first half we spoke about the states and various regions and different regions of our country. Now let's talk about the big cities, because the fact of the matter is these are the big cities that actually carry the big chunk of the load of cases for coronavirus. The rest of the country doesn't have as many cases. These are the ones that bring in the majority of our cases for the entire country. And in that list, Ahmedabad is one of those cities that had become a massive concern by around mid-May. The cases were going up very quickly and it had actually reached the top of the charts. But Ahmedabad has managed to curb that, contain that to some extent, and it is now seeing a rapid rise in recovery rate rather than the active cases rate. What we also found basis these charts that we built was that Delhi is seeing a rapid rise in daily cases, and this turnaround has actually happened by around end of May, and especially in the month of June. And you can see that in the last few days how the Delhi government, the Lieutenant Governor, the centre, everybody is talking about the rising cases and the spike in Delhi. We are going to see that chart and see what really changed. Mumbai, the recovery rate and active cases rate gap is really now narrowing. So we may be heading towards a better time. Only time will tell, though, if we manage to keep it contained. Bengaluru, a gradual fall in active cases and recoveries have been rising steadily. And Bengaluru, any which ways, has far lesser number of cases in comparison to any of our other metros. Chennai, the fall in recoveries and rise in active cases has been a concern. And what happens in Chennai is, and we spoke about it a little earlier as well, is that every time they get situation under control, there is some incident or some change in policy or just the fact that we are letting our guard down that leads to the spike one more time. Kolkata, the recovery rate and active rate are flat, but with Kolkata it is difficult to judge. There's a lot of controversy around the data. Jaipur is actually one of those cities that has managed to contain it very well. A steady fall has been recorded in active cases as far as Jaipur is concerned. And Pune may also be inching towards some good news, signs of improvement with active cases beginning to fall now. So in Maharashtra, the cities are showing some amount of improvement. Let's say good evening to the panelists who are joining us right now. Dr. Subramanian Swaminathan, Senior Consultant for Infectious Diseases at Gleneagles Global, Chennai. Mr. Javed Ansari, Senior Journalist, joins us this evening. Dr. Giridhar Babu, Professor and Head of Life Course Epidemiology at the Indian Institute of Public Health, is with us from Bengaluru this evening. Santosh Andale, Senior Journalist, joins us from Mumbai. And Dr. Anand Bhan, Researcher for Global Health, Bioethics and Health Policy. But first up, I want to go across to Vinay. Vinay and I have been, going through this data in much detail. And of course, we've been tracking these cities for a while now, Vinay. Let's begin with Delhi. Because Delhi is actually a case where the charts show that there was some amount of improvement and, taking place in the month of May. But as it is now very clear, even from government's reaction, the last few days have been a bit of a concern.
Yes, and I think the big worry till about 3 weeks ago was possibly Mumbai, and I think that worry now seems to be shifting a little more towards Delhi. In fact, I mean, even though our data projections are not suggesting what the government seems to be suggesting, and the government has painted a much more alarming picture, the Deputy Chief Minister went on record to say that they are expecting the cases to be 500,000. And that's as alarmist a picture as you can imagine. And I think that kind of alarmist projection is getting backed by how even the central government is reacting to it, because if you remember, the Lieutenant Governor just yesterday issued an order where they now want to take over India's top sporting infrastructure that exists in Delhi to be converted into COVID hospitals. So obviously, Delhi is looking at a bigger problem. Delhi is also a state that is, landlocked from with three different states around them. And we've been pointing out this problem to you, to our viewers, Tanvi, that the inconsistency of the policy, even though it's a contiguous, NCR is a contiguous zone, and viruses don't respect geographical boundaries. Viruses will not look at the policy in Noida as any different from what it is happening in Delhi. So that could have contributed some bit to it as well. Delhi is also a large pass-through state, and that could have contributed as well, because a large number of movement of people from other states to, say, the other states like Uttar Pradesh or Bihar was happening via Delhi, and all of those factors could have been a big factor. Also remember, Delhi and Bombay are the two biggest ports of entry, so there are issues that can be about contact tracing and all. The big worry, Tanvi, that I see for Delhi is that the government has pretty much now admitted that it is impossible to do any kind of contact tracing anymore. And now they've gotten into this spat over the jargon that one should use, which is about whether there's a community spread or not. For me, the fundamental question is that let's assume that there is a community spread now, because it's impossible to trace 500,000 cases. But for that, we need to have a policy which is much more robust in terms of testing. It has to be more robust in terms of isolation and containment zones. And we need to be more careful about what we open up. I mean, in terms of the public places, while you open up for economic purposes, the non-economic public activity possibly needs to be reined in for a little bit more than what we seem to have done as of now, Tanvi.
Yes, in fact, let me also bring in Mr. Javed Ansari for some more insights into what's happening in Delhi. Mr. Ansari, the charts also, show a very interesting story where we are now only seeing, a sudden increase which is happening around 25th to 27th May. It looks like things were coming under control. The recovery rate was actually improving and going to be surpass the active cases rate. But that's not happened. It's suddenly just turned, something's changed in the last 10 days. What's your own sense of how this is being handled in Delhi?
Well, it's been handled very badly, and it's been handled very badly by the center and very badly by the state government. They seem to be at odds despite their public posturing. There's utter confusion at the top. And look, the opening up was out of economic compulsions. And because we've opened up, they're now suddenly, after 2.5 months, everybody's out on the streets, and this kind of community spread is happening. The government is fighting shy because perhaps they don't want to admit, and they don't want to trigger off a kind of panic amongst the people. But the fact is that all of us who are living in Delhi are now on tenterhooks. There are not enough beds. Delhi is hardly testing 2,000 to 2,200 people every day. I mean, which is pathetic with such a huge population. 2,000 is not even a drop in the ocean. We need to be testing so much more. The Chief Minister went on record to assure us time and again that he's made arrangements, that Delhi has made arrangements for 4 times more than the number of patients that it would have. What we realize now, the rude awakening, is that actually we haven't even catered for half of that. There are not enough beds, there's not enough testing, and the citizens of Delhi, I'm sorry for sounding alarmist, but this is, I do believe that I'm echoing popular sentiment in Delhi, that the citizens of Delhi have been left to the mercy of the gods.
Okay, that seems to be a sentiment that has been echoed by many in the last few days. I actually just want to also read out a bit of a data to our viewers to drive home the point that sometimes what happens is that the numbers go up and down because of your testing policy, because of the way the numbers are getting reported, and some of these differences that we see in our charts also comes through. For example, in Delhi, 5th June, 6th June, 7th June, on a daily basis, in this month itself, they were reporting above 850 cases, 855 cases, then 918 cases, and 896 cases. Suddenly on 8th of June, the cases dropped to 587. Now, this was the day that the Delhi government actually tweaked their testing policy and asked the labs to not test asymptomatic people, which was then later on, a day later, overturned by the Lieutenant Governor. And then if you see on 9th of June, again the cases went up to 831. Vinay, before we move to the other cities, quick comment from you even on this. There are a lot of what we see, and we need to emphasize on this to our viewers. We are only putting out the data that the governments give us, and a lot of this data can actually depend on when they reveal the data to us. For example, yesterday the Delhi government didn't report it till late night. It only came this morning. How much of testing they're doing, the drop, the ups and downs in that as well. It's basically the numbers that are being declared by the government.
Yes, and I think the Delhi government has been a little confused in the last 3 weeks or so, whether they want to play a boxing match with the central government or they want to be a doubles partner like a tennis game and act very cooperative. They started off by attacking the central government. The Aam Aadmi Party spokespersons adopted a very vitriolic and hostile tone in the way they were reacting to various measures, and then they suddenly became conciliatory. This isn't the time to do politics, and the government actually went public to create some kind of a public referendum kind of a mood in Delhi, where they started asking questions and people to respond on whether we should open up or not, and then started giving solutions accordingly. They even went to the extent of saying that if Delhi has faced such a huge crisis of loads, should people from outside Delhi be prevented from getting a bed in Delhi, which obviously again got overturned the next day by the Lieutenant Governor, purely because it was constitutionally and legally untenable. Now, that kind of confusion was possibly avoidable. This is not the time to do all of this. As Javed was rightly saying, you needed a consistency in the policy. Delhi is a large state. We all know it's a landlocked state surrounded by different states. And you know that this kind of problem can happen. The anticipation of the problem was the key, which is much the same we saw in Mumbai, Tanvi, for instance, where the governments did not anticipate it and prepare and use the strict lockdown phase of the first 45 days to build that infrastructure. Delhi should have done that. They should have done that earlier, instead of now scrambling around to look for stadiums and hotels, as they're now talking about, to be converted into hospitals. Because there are more than one stories that are now going around in Delhi where people are running from pillar to post and going from hospital to hospital and not finding a bed, even though the much publicized and much touted app seems to suggest that the beds are available. So there has been a mismatch, and there has been a little bit of politics that has kind of derailed the fight against corona in Delhi. Tanvi.
Yes, and in fact, I wanted to talk about the healthcare infrastructure part in these cities a bit more, and we will come to that, because fact of the matter is these are the cities with 60-70% of the caseload of our country, but they don't have the 60-70% of the health infrastructure available in our country. They have far lesser, which means that there is a bigger challenge, which is what Vinay was referring. So we'll come to that. But let me just bring in Dr. Giridhar Babu, Professor and Head for Life Course Epidemiology at the Indian Institute of Public Health in Bengaluru. Dr. Babu, many of us are extremely intrigued by how Bengaluru has been an outlier in this. They have had far, fewer cases than any of the other big metros, and almost every other metro is struggling with the same kind of problem of high density, slum area. Becomes difficult to control it, to test it over there. The public health infrastructure becomes a problem. What has worked for Bengaluru?
I think what has worked in Bangalore is that from the beginning, Bangalore has implemented exactly whatever the Government of India guidelines had laid out. If it was sealed down, if it was locked down, it was perfectly implemented to the point in every place in Bangalore, number one. But even before that, what Bangalore did was something called retrospective contact tracing. So when the first case came to India, at that time, Bangalore did one new thing where for the last 1 month, they found out all the international passengers and they tried to identify who among them have symptoms and then followed it up. In addition to this, Bangalore has the advice of expert groups, which are meeting mostly 2 to 3 times in a week. So with all these inputs and by strict implementation, the key here, Tanvi, is that during the lockdown, we had the opportunity to do containment, which means you do active surveillance, find cases, so that you don't allow the infection to spread across many people. I think that was done very well in Bangalore. There is no different model. This is no difficult model, but we have done well only because we have followed the rules and regulations really well.
Yes, in fact, because Bangalore would also be one of those cities that did see a large number of people coming from abroad initially. A lot of business executives who travel a lot. There was quite a bit of movement, and so in the initial days there were cases. I think what Dr. Babu says, makes a lot of sense to the fact that if you don't do your contact tracing correctly in the initial days, and then don't implement your lockdown rules properly and allow violations to take place, then it becomes a problem. In fact, let me bring in Dr. Anand Bhan also in that. Dr. Anand Bhan, as we look at different cities and see how Delhi is struggling and in fact seems to be headed towards a worse situation. Mumbai is in a bad situation, but it does look like it may improve. Chennai is a case where every few days we see a spike, and situation going out of control. There is a lesson to be learned from Bengaluru, but can we do that now? Can we go back to implementing a stricter lockdown, because now we're seeing a larger number of cases?
Sure. So thank you for having me. Whether we should be implementing a lockdown, I think is something certainly which is an option on the table. I think the lockdowns are only useful if they're effectively implemented and used properly. If you're going to just think that lockdown is going to be a solution in any way, it's not going to happen. So I mean, whether Bangalore, whether many other parts of the country, especially the northeast, down south Kerala, places like Bhilwara, etc., which use the lockdown measure in terms of implementing contact tracing very well, and then ensuring that you isolated those cases which were positive, then you are going to be using a lockdown measure properly. If you are going to just implement a lockdown and not do anything else, or not do other things well enough, then you're not going to be able to have any success with controlling the spread of infection. So I think the lessons which are to be learned are not just the lockdown, it is also what do you do within the lockdown period, right? So, and how do you effectively use your public health infrastructure, your staffing, your outreach activities, your community engagement, working with the healthcare infrastructure, ensuring that everyone is following guidelines, that you have clear data available, that actions are done based on that data, and that information is transparently made available to the public so that there is public trust. Now, if you do this concatenation of efforts, then I think it is still possible for any city to be able to try to address a crisis situation that they might be facing. In fact, there is no alternative. The alternative otherwise is status quo and waiting for actually, the number of cases to keep on rising and keeping on planning and saying that, well, we are now prepared for 75,000 bed requirement, then 150,000 bed requirement. Where will we ever stop unless we actually try to put in our preventive measures? So I think that, no time is late enough. And I think now, even with the situation worsening in a few of our mega cities, I think the municipal corporations, the state governments and the central government all need to work in conjunction with each other, which, as previous panelists said, we have sometimes not seen. So that is really disturbing that, you have governments which are saying things which are not, which are not speaking, not seemingly speaking to each other or in variance with each other, and that does not augur well for an effective response. So hopefully we will start to see more cooperation and more clarity of response, both at the local level as well as the state and national level.
Yes, okay, I take what you're saying there. Let me bring up two more cities and speak about Mumbai and Pune a little bit, and let's bring up those charts for our viewers as well. We'll start with what's happening in Mumbai, and Mumbai is very interesting, viewers, because for the longest time the active rate was far higher than the recovery rate that we were looking at. Then suddenly the gap narrowed, and now it's just stable in that zone. Now, the fact that, the experts say that there is some amount of improvement and situation coming under control in Mumbai, yes, that's also reflective in the data analysis that was done by Niti Aayog, and we had brought you that data as well. And now that's what is, you can see even in this chart that at least in the month of June, there is some kind of grip that we are getting, at least on the number of cases in the city of Mumbai. Now, this is as far as Mumbai is concerned. Pune is actually doing a lot better, but Pune has had a bit of a spike, a series of spikes as far as the active cases are concerned. By the end of May, it actually looked like they were completely in control, and since that, the recovery rate has surpassed And it stayed like that. It's only gone further up, and the active cases rate has only come further down. So the Pune now seems to have managed to see considerable improvement. What remains to be seen is if this can continue as we now begin to lift our restrictions. Remember, and I want to point this out, in Maharashtra, there are separate set of restrictions for rest of Maharashtra, and then another set of stricter restrictions when it comes to Mumbai and Pune and Thane region, places where we saw high number of cases. So that has worked as far as Pune is concerned. Mr. Santosh Andale joins us this evening with his insights as well. How are you seeing the way these two cities have handled, and the fact that Pune seems to have struck the right chord, did the right things, and now is emerging out of that big challenge that it was facing in the month of April and May?
Tanvi, we have to completely agree. Compared to Mumbai and Pune, we are working towards to the right approach, door-to-door screening. Compared to less, we don't have much more facility in Mumbai like Pune. Pune's number is already reduced, and we are battle for the number of cases earlier. So now Pune, what Pune did the well job. They are doing door-to-door screening, quarantine facility, institutional quarantine, screening facility, everything they do. But compared to Mumbai, the slums area density of population is very high. Today is a very good day for Mumbai, like Dharavi cases, if you see, is rapidly come down. And they do the well job. Like we have to first of all thank to our doctor in Mumbai, because Mumbai is a financial city, a financial city of the country, and our doctors working day and night struggling to give the patient treatment. The only issue, we are not getting enough human resources in Mumbai. We are still struggling to get back the skilled human resources. Like we are calling people from outside the state. Like we have a little lesser staff, like doctors, nurses. We don't have. In Pune, we have enough infrastructure, we can say, and enough human resources. So what we have to do, we have to increase the human resources in Mumbai compared to other states. Basically, what we have to do, number of patients are increasing in Mumbai because testing has been done, but the human resources, we are less. Tanvi.
Okay, so Mumbai and Pune, Vinay, if you want to also come in on this, because again, close to our hearts, this is where, this is what we track extremely closely. Mumbai does have a big challenge, and that stays, and the health infrastructure part also stays. But it does seem like that the strict clampdown that happens, especially in the city of Pune, has helped. Of course, in crowded clusters, just like Mumbai, that threat still remains even in Pune.
Absolutely. And look, let's not make any mistake about it. Mumbai started off fairly badly. There was enormous confusion. If you remember, the BMC itself was indulging in a series of flip-flops over the policy they should adopt. They used to come out with schemes. Some of the implementation, the quotient of the schemes had left a lot to be desired. I remember when the previous administration of BMC in the leadership level, they had started a scheme of using thermal testing, and they wanted to use oximeters, they wanted to use devices which could test temperature. When they started actually going into the field, they discovered that Mumbai's weather was actually changing, and that particular machine was just ineffective in a very open environment like Dharavi. They kept changing those policies. They lost the battle in Dharavi to a large extent, and there was enormous confusion. In fact, there was confusion to the level where the three different parties who were actually governing the state were sometimes not even in sync over what was being done. The health secretary would say something and the minister would give you another version of the same policy itself. Having said that, I think at some stage they took the criticism that started coming their way positively and they changed. And what changed was, one, of course, the leadership of BMC changed. That was a bold decision to do because remember, it's not an easy decision for a government to take when you change the general in the middle of a war, which is what it was, because BMC is leading that operation in Bombay in terms of implementing the policies, and to change the general in the middle of a war was not an easy decision. It was taken. And that seems to have yielded some result because the new administration has certainly been a little more consistent with their policy, and the implementation of that has improved. Pune, I think, in that sense, is another good example because they started off badly but have recovered well enough to the level that now they seem to be on the path of being very, very comfortable if this trend holds. The other thing is, I think Bombay, I agree with Santosh when he says that there is a bit of a manpower issue. There is a struggle in terms of getting the paramedic staff, for instance, so the doctors are under enormous pressure and all the load is coming onto them. The Mumbai police came under a lot of pressure because of the large number of migrant movements that they had to handle. And remember, it was, I think, unfair for the administration to actually pile up all that pressure only on the police, including administrative work as well. That was a bit of a policy problem that we saw. But now that all of that is behind us, things seem to be recovering, and that's good news, Tanvi.
Okay, one city that we've often spoken about, and I want to bring it up again, is the city of Chennai. And just look at how city of Chennai is really performing as well. In fact, earlier in our first round, when we spoke about states, we also spoke about the fact that some of these southern cities and states are actually beginning to see a bigger challenge now than they did earlier. Now, Bengaluru is an outlier in that case, so we are not going to talk about that. But as far as Chennai is concerned, you've actually seen multiple ups and downs when it comes to active cases and recovery. So around end of May, it did look like, as far as Chennai is concerned, that the recoveries had surpassed the active cases. And you can see that where the two lines are crossing each other. And for a while, the recovery rate was higher than the active rate. But then that's now again changed in the month of June. So what's happening here? Let's try and understand from Dr. Swaminathan. Dr. Swaminathan, would you say that a lot of this is also reflective of when we go into the next phase of lockdown, when some more things open up, then we see a spike in cases, and perhaps that's what's happening to Chennai?
That may be part of it. Another part of it is also that the testing strategy has also changed. There's been more focus on only testing symptomatics. So we are probably not testing as many mildly symptomatics or asymptomatics that could also be contributing to the unusual numbers. So I think it's multifactorial. But yes, I think post-lockdown, there has been a sharp loss of control in certain areas, because of which we are seeing a very sharp uprise in the upswing in the numbers as compared to, say, Bengaluru. We were possibly comparable at the time of the lockdown, but we have since surpassed them, mainly because I think there's been a loss of control, and there have also been focal pockets which have taken off, some of which were completely unfortunate due to various reasons. And that those clusters have really driven the numbers. And even now, when you look at it geographically, there are certain areas in Chennai which contribute to the bulk of the load of cases. So when you look at it that way, you realize that it's the hotspots and those clusters which are really driving the numbers, but it's slowly starting to move into the rest of Chennai and becoming a more generalized problem.
Okay, but so you say that one of the factors also is the testing policy. In fact, earlier we had seen that Chennai wasn't even testing enough in the month of April, and then they ramped it up, which is where we saw a jump in cases as well. But as far as, if we compare it to Bengaluru, Dr. Swaminathan, in Bengaluru, they had strict implementation right from day one. They did a lot of contact tracing and got a grip on it right in the beginning. That perhaps can't happen for some of our other cities now. So then what's the solution to bring down the number of cases? Dr. Swaminathan, the question to you.
Sure. All right. So I think it's a little more complicated than that, because to me, as far as I can see, your first point that we moved in the containment strategy is absolutely key. We need to start playing it a little more sensible now. We can't be focusing on a preventive aspect, because that horse is long bolted. We need to have containment strategies where we have different strategies for different areas. And we also need to see how we can use the testing sensibly along with case management, because I think the concern is also that the mortality is rising, and that's possibly because we are focusing so much on the testing that we don't have enough protocols on case management at home, and there is a huge pressure for people pushing into hospitals, and that's overcrowding the hospitals with low risk people, and the high risk people often don't have a place to go. I think we need to have a strategy on that, which I think the government needs to address that straight away.
Okay, I take what you're saying. In fact, we've largely covered most of the big cities that I wanted to introduce. We're going to keep running those charts for you. Ahmedabad, viewers, is a city just like Jaipur that has seen a significant turnaround in April, towards end of April. They had a high number of active cases. The active rate was much higher than the recovery rate, but a turnaround happened around end of May. And now the recovery rate and the active rate are kind of just, stabilizing in that level, and that gap really continues. That's actually very similar to the graph that we saw even of Gujarat. So it looks like exactly the way Ahmedabad is behaving, so is the rest of Gujarat. So perhaps this is the city that brings in the majority of cases as well. Now let's move to the second aspect. And the second aspect is, how will these cities tackle the cases? And Mr. Javed Ansari, let's talk about the problematic cities, whether it's Mumbai still, because of the large number of cases that we're reporting still every day, and Delhi, which is now beginning to see that kind of, 800, 900,000 cases every day. They have failed to build up their health infrastructure. Now, will that become challenge number one? And until we do that, should we again go into the lockdown? What are the authorities now thinking of doing?
Look, the authorities are none the wiser. They are groping in the dark, and so is the public. You can't, at the time of war, you can't build up infrastructure. So the infrastructure is virtually non-existent. It's abysmal. They ought to learn from Kerala. They ought to learn from the other cities, from Ahmedabad, from cities that have turned it around. Do things on a war footing. I'm told that the worst is yet to come, the worst is ahead of us, that this will continue to spike and peak either by the end of June or in the first half of July, and it's only towards the end of July that we will see some kind of, downward trend. Well, till then, you just survive in hope and in prayer, on a hope and a prayer, because there is very little. There are not enough beds. There's virtually no testing happening. 2,000 testing 2,000 people for a population of over 1 million amounts to absolutely nothing. They need to ensure that there are more beds, build quarantine centers. There are vast sporting stadiums here which are lying vacant. Use those. Use hospital. There's a mammoth hospital here, the All India Medical Institute. Why can't that just be converted into a COVID hospital? Let people be quarantined there. Let people be quarantined in these 5-star hotels which have been shut. And for God's sake, please shut down places of worship. We can all pray from our homes. I'm a believer. I pray 5 times a day. I'm very happy doing it from my home. Don't open all these places up. Don't open malls. These are things. This is not essential. We can do without these things. So as a resident of Delhi, I shudder to think what lies ahead of us. Tomorrow, if God forbid, I contract this, I won't know where to go. Even somebody like me who's a journalist, and I know few people in this town, I won't know where to go. There are, unless, we've just been left. It's all Bhagwan Bharose. I'm sorry to sound alarmist. I'm not one amongst those, but the situation is such that, you ask anybody, you hold a poll in Delhi, and 99% people will say that we've all been left to the mercy of the gods.
Yes, absolutely. And you know, it's not being sounding alarmist, Mr. Javed Ansari, because what you're saying are simply the facts. The government itself sounded as alarmist as it could be yesterday when they came out and said, well, we are anticipating 2.5 lakh cases by, July, and end of July it could be 5.5 lakh cases, which means we need 80,000 beds. Let's get the stadiums going now. Let's get the hotels going. Suddenly, this conversation that is now happening in Delhi, the same government, Vinay, 15 days ago was telling us their health infrastructure is ready. Arvind Kejriwal in the beginning of May was the first one to come out and say we cannot be in lockdown forever. Our health infrastructure is ready. The cases will go up when you lift the lockdown, but we are prepared. Let's go. Let's open our shops. Let's restart our economy. Now it seems like as if the health infrastructure is not ready.
Yes, and I think now that we've seen about 3 months of this war against corona, there is one very clear pattern. There are chief ministers and there are people who govern our states who have believed that lockdown was the solution. There are some who were probably smarter who realized that lockdown was an enabler. That's not the solution. And I think if you just think that lockdown is the solution, then this is what happens, because that's not what the lockdown was meant for. The lockdown was meant for you to enable you to prepare for an eventuality where the cases will rise. And in Delhi, I sense that there is a bit of a smugness that they had, that our infrastructure is the best and we are the greatest and we have the best facilities in the country and hence we'll be able to handle it. I think this was a little bit of an ignorance about understanding how this virus works. There was a little bit of an ignorance about understanding the nature of the city of Delhi and the requirement that would have exponentially grown. It doesn't help if you stand on 10th June and say that contact tracing is impossible. Of course it is impossible, because now the number of infected cases, the likely number of infected cases is just way too high. That's where I like the idea of that Bangalore pursued, because that's the example of how they used the lockdown not to think that this was a solution, but used as an enabler and went very hard at contact tracing right at the start when the numbers are fewer and ensured that the spread did not happen. And that's where Delhi seems to have lost the battle. And now we will only play catch up. I mean, this is not something that they could have prevented it, because Delhi does have superior health infrastructure compared to other cities. Javed is absolutely right. You have AIIMS, you have Sadarjung, you have very large hospitals and stadiums and various other places which could have been converted into containment zones or isolation wards. Nothing of that has happened till now. It's only now that they're beginning. Tanvi.
In fact, just very quickly on that, back to Mr. Javed Ansari. Mr. Ansari, I know what you're saying is absolutely right, but do you fear that won't happen because of also politics? Because when it comes to the national capital, everything boils down to the center versus state. And the center in this case obviously hasn't decided to open up AIIMS hospital for more COVID patients. It's such a huge hospital, but I believe only about 250 to 300 of those beds are actually dedicated for COVID patients. And likewise in many other hospitals, it's something that the center should be immediately looking at.
COVID, Tanvi, if either Mr. Kejriwal or those who govern at the center believe that the fault will lie only with their opponents and not with them, they are mistaken. This will sting them in a manner they cannot fathom. Everybody's sitting pretty at the moment, but you talk to people on the streets, and you sense their sense of fear, their anger, and their total helplessness, and this is going to manifest. I do believe that at some stage, because Delhi happens to be the capital of India, and therefore they can't allow it to run aground, the center and the state will get their act together. But when will they do that, and how much of a toll by then will COVID have extracted in terms of lives of the people in Delhi is anybody's guess. But the fact is that at the moment, they haven't even begun it, and they ought to have done it day before yesterday. The signs were there. This was a pandemic foretold. This was a disaster foretold. Yet they were both sniping, trying to score political points. When I was absolutely right. In the beginning, they were both trying to score political points. Mr. Kejriwal assured us that he's made arrangements for 4 times number of than what is required. And what you realize now is that that not even half of that is true. The center is sitting pretty, very happy that allowing Mr. Kejriwal to stew in his own juice. But the fact is that if this spills over and if this blows up, it would spare no one. Even the center, even those sitting pretty at the center will have to take a lot of the blame.
Yes, absolutely, and it can't be just one party's responsibility. Unfortunately, right now it's just become a blame game. But let me go across to our other panelists as well, and Mr. Santosh Andale, because we are talking about health infrastructure in these crucial cities. Delhi is facing a massive problem right now. They're looking at stadiums, they're looking at hotels. Some of the hotels don't want to be converted into quarantine centers or treatment centers. There are legal battles that are now beginning. Mumbai has a similar problem. That we are right now looking for scouting for locations for isolation centers. The people don't come to the hospital, they should stay at home. There is a big battle right now going on between townships and societies who don't want to use their own setup for people who are living there, and saying no, we don't want that kind of a risk internally in our societies.
Yeah, actually, tell me what happened in Mumbai. There are most of the places like Mumbai is the first city in the country. Must be we in the field hospital like Jumbo Facility Center we set up in Mumbai like Worli in Dome, where we set up a ICU. First time in ICU set up in that area. We have isolation center across the city, but most of the isolation center right now is empty because of there are some basic hygiene infrastructure issue in the isolation centers. Many of the people wanted to bed in the hospital. They don't want to go to the isolation center directly. Everybody run pillar to post in the Mumbai to get the hospital. But most of the people not getting bed in the hospital. This is the current situation in Mumbai. Across Mumbai, we have more than 5,000 bed with the oxygen point, along with the oxygen point. But the issue is, every people wanted to go to the hospital. Asymptomatic patient, most of the bed is occupied in the hospital. Many of the people who are asymptomatic, they also wanted to go to the hospital, but they are not getting a bed. So major struggle in Mumbai is the health infrastructure. Public health infrastructure should be beef up. It's a wake up call to all of us. We should beef up scale up the health infrastructure, and everything should be fair to the poor people, because most of the poor people not getting bed properly in the city. They have to wait at least 8 to 10 hours. And now the isolation center should be more human resources, the nursing, doctor, paramedics they need. Tanvi.
Right, absolutely, absolutely. In fact, viewers, the biggest challenge for Delhi and Mumbai, the two of our biggest cities with the largest number of cases, and more so for Delhi right now because the cases are still going up, is not just beds. It will also be ICU facilities, it will also be ventilators, it will also be support staff. You need doctors and nurses and attendants who are going to be present. And if you see, horrifying stories are emerging from hospitals in Mumbai and Delhi. For that very reason, you don't have this support staff. Mumbai at one point said, okay, let's see if we can get more support staff and medical staff from other states, because we need that. These medical fraternity people have been working round the clock for 3 straight months now, and they will have to do so for several more months. So there has to be some amount of relief that also comes for them. In fact, Dr. Babu, let me bring you on that aspect. How are cities preparing for the longer haul, for the fact that this isn't going away? So we will need people and beds and facilities for several months now to deal with COVID.
Yeah, I think, Tanvi, what we are missing here is most of the cases, even in Delhi, Mumbai and Chennai, are contributed by clusters. And we have almost forgotten the role of clusters here. Now, I'll give you an example in Chennai. Nearly more than 2,500 cases are linked to the Coimbatore market. The same thing in Dharavi slum, same thing in the Nizamuddin, same thing with the Nanded pilgrimage. So the story is very clear all over the world. Clusters are the ones which have to be prevented. Japan, even without lockdown, could do so well by following prevention of clusters, prevention of crowded places, ensuring that in the close contact settings, there are no close range conversations or anything of that sort. By following these principles, even now in the metros, we should be able to prevent the spread of the cases, number one. Number two, to your question, we need to be not be in complete despair, but then practically and very pragmatically plan. In order to do that, it's not the ventilators that we require in terms of intensive care units. It is the oxygen supply. So again, one more good practice in Karnataka is when they realize that this is going to be the problem, all the general hospital beds are fitted with oxygen cannulas so that when they require, high flow oxygen can be given. Now they are developing a plan in terms of which hospital will be used first and then which will be next. They've already taken partnership with the private in terms of how they'll manage the workload. Even now, let's not be in despair. Let's not feel that the game is over for some of our cities. That's not true. Let's plan and then make sure that these 3 C's are followed. Prevent cluster formations, ensure that there is close contact settings are reduced, and in all the closed spaces, make sure that we are managing physical distancing and masks. Now, these are the 3 C's. Then let's pragmatically plan in terms of how to really, on a real time, distribute the beds and the ICUs. We need to get our acts together. It's not just the government's responsibility. We all need to work together in terms of finding solutions, even in the places where higher burden is there currently. Tanvi.
Okay, fair point that you've made. In fact, let me bring in Dr. Swaminathan on this as well. Dr. Swaminathan, what should be the way forward for some of these cities in terms of ensuring that the healthcare infrastructure is there? Honestly, it should have been there by now already, but there are cities like Mumbai and Delhi which are struggling badly.
So at least some states have made some changes on that. In Tamil Nadu, they've already identified some areas where they have quarantine facilities available, whether it's an IIT Chennai or other places. I think, like was mentioned, we need to have setups which can have quasi-medical facilities and a triaging-based patient movement into the medical facilities, because we can't afford to have everybody coming into a healthcare system and crowding our hospitals so that it becomes completely unavailable to the patients who desperately need medical care. And unfortunately, that is exactly what is happening right now. So, I mean, it's easy to say what I'm saying right now, but it's a very practically difficult approach. And one approach that a lot of centers are doing is taking control of the hospital so that they control the narrative of who gets into the hospital and what kind of care is given and things like that. Not a very easy thing to do, because obviously there are other issues which could be, which could be a problem here. But short of doing this, I really don't see how the government can really control the narrative.
Well, I want to reiterate the point that Mr. Javed Ansari was making earlier, that in some cities the situation is now still so serious that people don't know what to do and where to go. And this entire system of allocating hospitals and allocating beds and testing and then telling you which center, quarantine center, level 1 hospital, level 2 hospital should you go for, it's just become so complicated that it's turning out to be a nightmare for quite a few people. And Dr. Bhan, while that's one aspect of it, the other aspect is availability of healthcare workers. Now, if we are going to say that the number of cases are still going to go up and we haven't peaked yet in many parts, where are we going to find these many healthcare workers? Dr. Bhan, the question is to you that, one big challenge which will also be as we build the healthcare infrastructure, where do we get the additional healthcare professionals from?
Yeah, that's always going to be a challenge. I think, the advantage, for example, in China was that there was a localized spread of infection in Wuhan, and so they could get healthcare professionals from other parts of the country. So listen, I think, it's going to be a bit of an agenda of redistribution, which might mean at the state level and across states, we might need to do some redistribution of health professionals. It's also, I think, a time to talk about retraining, because a lot of this, the frontline work can actually be done by healthcare providers who don't need to be specialists always. But, this is something we've been talking about since March, February, even earlier actually, and saying that you need to prepare for that eventuality and start training people so that they know basics of how to do intensive care, basics of how to manage patients, etc., and, how to do triads, etc. But I think many governments failed at that. But even now, I think it might not be too late. If we can retrain, if we can keep doing intensive training and ensure that we can deploy staff in such a way that they are able to address the basic
Right.
care requirements, and then specialists are available when there is a requirement for, because everyone will not require specialist care. So I think it's just a matter of being very smart about redistributing your existing healthcare staff, ensuring that you minimize burnout, because that is another worry that I have as this infection spread continues and a lot of our healthcare staff get stretched to their limits. There will be burnout. There will be many of them who will get infected and they will fall off the workforce. And then what do? We will have an even more ill-prepared health system there with the lack of
Yes.
human resources. So I think the time is now to start planning and retraining some of our other staff members who can step in, who can be the reserve, and as and when they are required, they can be deployed.
Yes, in fact, that's a problem, in especially in cities like Mumbai, also with our police forces. So it's our civic body officials who are out there on the field, organizing and testing and screening. They are the ones who are also getting infected. Also your police officials, and then your own healthcare workers. Three departments where the authorities will have to give specific attention in these cities to ensure we are able to battle this out in the long run, because the coronavirus is not going away. I'm completely out of time, so I'm going to thank all of our panelists for joining us. Very quickly, viewers, let's one more time go through what the key takeaways were from the numbers and the data graphs that we put out. Now again, these are not projections. This is the data available, given to us by the government. We've just simply made some calculations and drawn these charts for you to understand where your city stands and how it has been faring. Ahmedabad has seen a rapid rise in the recovery rate. It is actually now doing much better than what it was last month. Delhi, on the other hand, is the other way. There's a rapid rise in daily cases since the 1st of June. And the anticipation as per the government itself is that it's going to worsen from here on. Mumbai, the recovery rate and active case rate gap is narrowing. So that's slightly better news than what Mumbai had also seen last month. We seem to be having our better days right now. Bengaluru, an outlier in terms of low number of cases through this entire pandemic. Gradual fall in those active cases as well, and the recoveries are rising steadily. Chennai, the fall in recoveries and rise in active cases is what is visible right now. Kolkata, recovery rate and active rate are flat. Jaipur, just like Ahmedabad, has been a city that's actually done significantly better. It has recorded a steady fall in its active cases, and Pune is now showing signs of improvement with active cases starting to fall. So that's as far as the information as of 10th June's report is concerned. We're going to keep a close track, keep getting you these updates. The challenge of healthcare infrastructure still remains in all of those cities, and that continues to be the big focus here. Thank you so much for joining us. Welcome back. Let's get you the latest from Assam, from Tinsukia district of Assam, where there is a massive fire that is raging on. In fact, 2 people have died in this fire. The 2 bodies that were recovered are suspected to belong to the firefighters who went missing yesterday. The blaze can now be seen for a distance of 30 kilometers. Viewers, this is a fire that broke out in a gas well that was under the Oil India company, and Oil India officials are now saying it will take at least 4 weeks to put off the fire. 16,000 families have been evacuated, have been shifted as the fire continues to spread to areas in that zone, to villages in that zone. Let's go across to Arindam to get you more. Arindam, take us through what is the latest as far as the firefighting operation is concerned.
No, still rages on. It has been contained, but the fire in the oil still continues to below, and it can be seen from several kilometers away. And experts from the Oil India Limited, the ONGC, the State Disaster Response Force are trying to contain. It is right now uncontrollable, and as well as from Assam government, it has been made clear that it will take another 1 month's time to contain the flames. So let me bring into perspective as to how this fire has broken out. Gas well in Bagjani was leaking gas from the past 2 weeks, from 26th of May. And day before yesterday, a 3-member team who were here on invitation because the fire was uncontrollable by the Oil India Limited, and 3-member team from LR Disaster Response arrived at the scene.
All right, we have a bit of a patchy network there with you, Arindam, but thanks so much for joining us. 2 people have been suspended, 2 officials, for negligence. The gas had been leaking, like Arindam was saying, for the last 2 weeks, and then it broke into a fire, which will now take at least a month, officials are saying, to be put off. So clearly a big challenge there and a massive problem that continues in the state of Assam. Well, we're completely out of time on this edition of the Urban Debate. Thank you so much for joining us.